The next step in the general examination after the head is the examination of the neck. Really, in the examination of the neck, you have to put in your mind the following structures. First of all, you have to detect the trachea, whether it's central or slightly deviated to any side. And then you have to check for the thyroid. After that, you have to check for lymphadenopathy, lymph nodes of the head and neck. And after that, for the vasculature of the neck. In addition to that, you have to see the contour of the neck. For example, short-webbed neck may occur in patients with Turner syndrome, and long neck may be a manifestation of Marfan syndrome. In the examination, first of all, in the examination of the trachea, you have one of the following two procedure or maneuver. First of all, you have to introduce the left index, the right index finger over the suprasternal notch, exactly in the midline. You will feel the trachea, which is central and or slightly deviated to the right. This is the first maneuver. The second maneuver, you can use three middle finger by placing the index finger and ring finger over the attachment of the sternocleidomastoid with the sternum, and the middle finger is pressed into the middle to feel for the trachea. The trachea, as I said, should be central. This is for the trachea. After that, you have to ask the patient to swallow to see any thyroid enlargement. Okay, all this about the thyroid and the trachea. After that, you have to check for lymph node in the following group. First of all, the submental group, submandibular group, pre-auricular, post-auricular, occipital group, here posterior cervical. Anteriorly, we have in addition the tonsillar lymph node, superficial cervical, deep cervical, scalene lymph node, and in the supraclavicular fossa you have to check for the supraclavicular lymph node. Really, in the examination we have two steps. First of all, I'll examine anteriorly and then posteriorly. بس حماد تقدر تقعد لنا بس أصير وراك يعني أصير ورا ظهرك. Okay, I'll check the following group as I said. First of all, you have bilaterally to check the submental and then submandibular group, pre-auricular group, post-auricular group, occipital group, also bilaterally, and then we have to examine the anterior neck. Really, in the examination of the neck vessel, you have to tilt the patient to the side of examination, and it's preferable to examine just one side. First of all, the tonsillar, and then superficial cervical, deep cervical, and then for the scalene lymph node in the following maneuver, you have to press the index finger between the sternocleidomastoid and the clavicle in the following way. In such a way, you have to search for lymph node, and then also you have to check the other side, tonsillar, superficial cervical, deep cervical, and for the scalene lymph node. After that, I'll ask the patient to shrug his shoulder for the supraclavicular fossa to be more obvious. حماده بس تجنح هيك خفيف ويديك لقدام شوية. Okay, this is the supraclavicular fossa, so you can palpate here for any lymph node. هاي عشت ايدك. After that, I'll check the posterior lymph node from the front. بس علي سبعة عين عادل. عشت ايدك. Okay, I'll check the posterior cervical, the occipital lymph node, and the post-auricular lymph node. Okay, على راحتك. Really, if you find a lymph node, you have to determine first whether this lymph node is a normal finding or it is an abnormal finding. Normal finding, really, when a person, healthy person, may have a lymph node that is less than 1 cm, and especially in the submental, in the submandibular area, or sometimes in the inguinal area may reach up to 2 centimeter, which is normal. Anyhow, when you find a lymph node, you have to detect the following characteristics of that lymph node. First of all, you have to detect the size of the lymph node, position, I mean the site of the lymph node, attachment, whether the lymph node is attached to the underlying muscles, for example, overlying skin or subcutaneous tissue and so on. And then you have to detect the consistency of the lymph node, whether it is hard, firm, soft. And then you have to detect the other characteristic of lymph node, for example, delimitation, delimitation, for example, if the lymph node are matted together in case of tuberculosis, or they are desecrated and symmetrical in case, for example, of lymphoma. And then you have to detect the shape of the lymph node, whether they are ovoid in shape and spherical in shape and so on. In addition to that, really, and the most important thing is to know the sign and the sign of the detection of the supraclavicular lymph node, and what is the name of supraclavicular lymph node if it is get enlarged from the metastasis. Really, we call them the virtuous lymph node, and its sign, we call it the Kreuzer sign. All these issues and aspects are about the lymph node examination of the neck.